I think this was much bigger than Lupin. This was for industry at large today, and I think we came up with some very specific measures of what we want to do. For example, engaging with stakeholders, and I've never seen the kind of interaction that we had today. Sharing best practices, and we've started that process. That's something that we're going to do as well. This is a journey, and as you heard, we've committed to do significant improvement in our quality systems in the next 4 or 5 years. It's a journey. It's not a destination. But I think it's the onus of the champions of industry to lead industry overall. So I think we've taken on that mandate, and we hope to deliver.
So you did mention that 2020 is the time by when you want to achieve a certain benchmark for Lupin as well as for other companies on behalf of IPA. Could you reiterate that for us and mention a roadmap as to how really you precisely want to go about this?
Yeah. So I think the question there was to reduce to a certain amount of defects per million to get to Six Sigma level. And the point was that other companies have done it. Why can't we as an industry? And the goal was that, yes, within the next 5 years, we should invite the FDA back to show substantial improvement in quality systems. How is that reflected? That's reflected in reduced warning letters, reduced import alerts, much better quality delivery, quality outcomes.
What has been your interaction with US FDA particularly so far, considering there was a lot of brainstorming on the table, there were a lot of ideas exchanged? What was the stance of US FDA, and could you take us through some of the key measures they recommended for Indian pharmaceutical companies like Lupin, for example?
So they've been very positive and forthcoming. We've had 2 rounds of discussions with the FDA in the US, and then it's been followed with their representatives coming here, not them only, but the MHRA, the EMA, and the Indian authorities as well. So I think authorities are willing to engage significantly. I think they've shown us that they're very happy to engage. It's up to us now.
Some key measures that they want domestic companies to focus on. Data integrity was one thing that they spoke about quite a bit. It was one area they highlighted a lot. Could you run us through the key concerns as far as data integrity is concerned? Also, any other issues that they flagged off?
So I think pointedly, it's not about India, and I think they made it very clear these are situations that they see across the world. And I think data integrity, if you see, not just India, but across the world, in terms of warning letters, 9 out of 10 warning letters are cited on count of data integrity concerns. We had a great presentation on that. That presentation will go up on the IPA website as well. And I think we got to understand their mindset on how they approach data integrity, and I think that will go a long way in us being able to address it.
My last question really, the past year more so, we have seen many domestic companies, particularly the top 5 who have a substantial exposure to the US market, see a dent in sales mainly on 2 counts, one being the late ANDA approvals, considering there was a huge backlog to be cleared by US FDA, and the second one being the number of inspections carried out in manufacturing facilities in India, and also the feedback that US FDA gave to domestic companies, asking them to correct and kind of upgrade compliance matters. How do you see this going forward? Do you see this hampering, I will not say hampering, but do you see this having a bearing on sales going forward? Do you see an improvement? Could you run us through some aspects as far as this is concerned?
Sure. So I think the ANDA approvals are improving for the industry at large, for Lupin in particular. We're seeing the FDA give target action dates for every product. We're seeing them deliver on the GDUFA promise as well. So I think the approvals are definitely on the uptick. Inspections are a reality of life, and I think the FDA is going to scrutinize the industry overall much more than it has in the past. It's doing it around the world. And like they shared today, India is getting its proportionate share. It's not getting more than its proportionate share of inspection. So I think that's a reality of life. We have to live with it, and we have to excel at it.
Are you concerned about price erosion in the US market, considering that some of your top products have seen some sort of an erosion of around 30 to 40%, particularly in the past 1 year? Trecor, for example. How are you looking to mitigate this, and do you have any strategy in place to combat this?
Yeah. So I think the generic industry is about individual product opportunities and pricing going down. I think as an aggregate, what happens to the product basket is important. Typically, we see 5-6% erosion in the inline products. In some years, we've seen 10-12%, and that is bothersome. But 5-6% is the reality of life, and I think the only way you can build a generic business is with new products. So you have to have a steady funnel of new products coming, filing, approvals, launches. Unless that process goes on regularly, that entire business plan is going to be broken.
You are focusing on innovation drugs as well, and you do have a focus on biosimilars and complex generics as well. Could you bring us to speed as far as these areas and segments are concerned? What are your main plans, and how really do you want to scale up operations by 2020 in these segments?
Sure. So I think the big complex generic bucket that we're handling is inhalation. We're very deep in that space. We will start clinical trials for at least a couple of products within this financial year. We're also focusing on complex injectables. Biosimilars, we're basically chasing one opportunity for Japan at this point. Like we shared earlier as well, in many ways, Indian pharma missed the first wave of biosimilars, and they will be perfectly in time for the second wave, but that is a longer horizon. But for us, the complex generic story is about inhalation, then injectables, complex injectables to start with, and then regular niche injectables as well.
Find us on Facebook at facebook.com/ETNow, and don't forget to click the like button. You can also follow us on Twitter at ETNowLive. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/user/ETNow.